Emergency caesareans are made all the more risky by the limited practice that junior doctors can have in performing them. But a UK team has now developed a training model that it hopes should change this.
Emergency caesareans are something that happen every day. They're very common. A few of them can be very scary and quite frightening. Because it's an emergency, it's often out of hours. There may be more junior doctors attempting that delivery. There isn't time to call in senior people because it has to be done in minutes. And the very first time many of us are exposed to this difficult delivery is often the first time, and it can be associated with considerable trauma and danger both to the mother and the baby.
Dubbed Desperate Debra, the model simulates just how difficult performing an emergency caesarean can be.
Basically, the first thing you do is set the model up. Now, to mimic the sort of live situation, we need a lot of gel. Okay, so it's messy business, but that's real life. The innards of this has been designed to mimic the sort of inside of the pelvis and the uterus with all the soft tissues, so the head fits very snugly into the pelvis. And essentially, it's being pushed in by this spring. And on here, there are various markings that tell you the way the baby's looking and the way the head is either flexed or deflexed. We particularly wanted to mimic the situation that is real, and so we went to a lot of trouble to ensure that the fit of the head in the pelvic was realistic. The materials that it's made of are exactly that. We can use gel and make the area very moist so it mimics the same suction problems and the same dynamics. The feel of the materials are like real tissues. The way the baby's head moves, its shape, the bones underlying the skin have all been designed to move and mimic the real life situation. And what was very reassuring for us is when people first tried this out, the first thing they go is, wow, that's just what it's like. So once setting it up, the clinician will essentially place their hand through the cut, which is ready made. They apply their fingers down between the sort of pubic bone and the baby's head, and you have to wriggle your fingers to beneath the head. Now this is quite hard work, and already I can feel my fingers being really squashed. It's not something you could do more than about 3 or 4 times in a day without having to have a rest. Once you've got your hand beneath the head, you basically work out which way the baby is looking. You flex the head so that the head's looking down so that there's less, and as you do that you can see this moving into the right position. So I can see that the head is flexed, and then when it's flexed I know that it's what we call presenting diameter is much less and safer to bring out, so I pull it up out of the pelvis, okay, and then as I pull it out through the wound and out it pops like this. Okay, now that was quite hard work, and I've got this on the easiest setting. So if you can see how as the head flexes and looks down like that, the amount of space it has to come out is less, and that's a much safer delivery. So this whole model mimics the real life situation where the head can move from left to right, up and down, and we can actually see what's happening as the clinician does that. What you can do is return it and put this at a much harder setting, and have very, very difficult deliveries. One of the interesting challenges we had was getting the head right. Okay, so when we first started using a head, we'd taken one off the shelf that someone else had created and started using it. We soon realized that it wasn't quite right, and when we went back to the drawing board, measured it, looked at its dimensions, it was not realistic at all. So we had to literally go back to the shop floor, get the designers in to see real babies, feel what they were like, what the bones are like under the skin and so on, and came up with something very different to what we originally used. And when we saw this, we said, yes, that's absolutely the real thing, feels much more realistic and actually behaves much more realistically. So it was a matter of not taking anything for granted, working with the designers, and I think we've come up with a product that's very different and very much improved from the original models we took off the shelf.